Ohio House Bill 454, also known as the Save Adolescents from Experimentation or SAFE Act, Families, Aging, and Human Services Committee. First hearing, February 17, 2022. Testimony by Representative Gary Click, proponent.
I will now bring forward House Bill 454 for its first hearing and would like to call on Representative Click to present sponsor testimony. I was going to say welcome to committee, but you already live here, so.
Thank you, Chairwoman. I sure appreciate that. Chair Manchester and Vice Chair Catrona, who's not here, and also I apologize, Ranking Member Denson. I gave Representative Liston your job, but congratulations on filling that spot for now Minority Leader Rousseau, who's also done a fine job on this committee. And Representative Liston, I promise to give you the same respect I always have, even though you're not the ranking member. And Representative Humphrey, we certainly welcome you to committee. We're glad to have you here, along with Representative Smith, who obviously had to step out. Do you remember what it was like when you were a child? You know, it's an honor to give testimony to you today, by the way, and I thank you, Chair Manchester, for bringing this forward. As children, we have many visions of things that we want to do. We might be someone like Neil Armstrong, who loves flight, and we dream about space, and someday we actually do go to space. And then there are many other people, though, who had that dream of being an astronaut, and they just become productive leaders of society in many different ways, different other areas, and so forth. Because really, as children, childhood is a time of play, imagination, and exploration. It's where we can dream about many different possibilities, many different futures, and we can pretend to be whatever we want to be, and so on and so forth. So time is filled, or youth and childhood is filled with many of those things. And as a child with limited life experience, every circumstance seems to be immediate. Sometimes it's hard to imagine or to envision a life many years down the road. And I'm honored to bring this bill before you today because sometimes adulthood adds a different perspective. When I was asked if I would carry this bill, bills like this were not on my radar when I came to the legislature. I really didn't have an interest in it. When I was approached about this bill, what changed my mind, what motivated me was sitting in a room with some teary-eyed families who've been through this, who've experienced this. And I spoke to those who asked me to carry the bill, and I said this. I said, if you expect me to throw out red meat, hateful rhetoric, be disrespectful to people, I'm not going to do it because that's not who I am. And they said, that's exactly why we want you to carry this bill, because we don't want that either. This bill is not about hate. You're going to hear some people say that along the way. This bill is about kindness. It's about love. It's about compassion. And we can disagree on certain things. We can disagree on certain approaches, but that doesn't mean that we have to hate each other or be unkind to people. And that's certainly not how I'm going to be. And you have my word on that. And ever since I've introduced it, you have seen that in the way that I have displayed myself and the way I've discussed this bill. But I'm going to ask you if you would give me just a few moments today to explain to you some of the things that have come up in my research as I've explored this bill, as I've read books, as I've listened to podcasts, as I've talked with experts, medical experts. I've talked with people who have experienced this life and lived this life. There's a few things that have stood out to me. Now, first of all, you're going to hear words like trans, transgender, trans man, trans woman. The clinical term is gender dysphoria. And gender dysphoria is real. People experience that. And people experiencing gender dysphoria deserve to be treated with all of the same love, respect, kindness, and compassion as anyone else would. Gender dysphoria is an extreme discomfort with one's sex. Sometimes it is associated with a strong desire to be the opposite sex. Sometimes it's not. And you've probably heard the term non-binary, or sometimes they just use the abbreviation NBs for non-binary. They don't want to be the opposite sex. They just don't want to identify with any sex. But what surprises me the most and what troubles me the most is when there is a lack of professional curiosity that goes along with this. The professionals are not all in agreement on this. You're going to hear some testimony from the other side, and I look forward to that. But they're going to say, clinicians say this, and professionals, why don't we listen to the professionals? I've done a lot of research, And there are a lot of professionals who have differing opinions from those that are standardly publicized in the press and in the media and on their own websites. Clinicians are not in agreement. But in contrast, there's an increasing social pressure to simply accept that some people are trans and to say this is what it is and there's no reason. It was just somebody made a mistake. They put a boy's spirit in a girl body or a girl spirit in a girl body. You've heard the phrase, a girl's brain in a boy's body and a boy's brain in a girl's body and things like that. That's just not scientifically accurate. And so we want to do, when we're talking about delving into medical interventions, we want to be careful. We want to make sure that we have the science on our side, not just a philosophy, not just an idea, not just a strong belief, but this has to be filled with science. And that's what we're here to stand up for today, because there are people on the opposite side of this issue who only want one answer. The only answer is gender affirmation. And they will say things like, if you're not performing gender affirmation, if you do not affirm the child, then that must be some sort of a conversion therapy or something like that. And neither is that true, and neither is that the recommended process that we should take from that. So one of the factors is that there's actually a lot of significant pushback on this, even within the LGBT community. There are many people in the LGBT community and even in the trans community. So Trade Voices is an example of one group that is in the trans community that says, listen, we're happy with our transition, but transitioning is hard. It's a very difficult choice. It has lifetime consequences, a lot of expense, and a person ought to be grown, mature, and ready to give informed consent before they pursue this pathway. So this isn't just one side of the aisle. It's not just one ideology that we're presenting here or one position. In fact, as I began to study this, I learned that there are both Republicans and Democrats who take our position, as I said, and also people within the LGBT community. So there's really a diverse number of people from a diverse number of walks in life who say, let's just take our time. We're not saying what the end decision should be. We're not saying what decisions you should make as an adult. We're not making any moral judgments on anyone. But what we are saying is there is a time and a place where we make these life-altering choices. We look at causality, and I think I already addressed that a little bit. I got a little bit ahead of myself. And we really don't know what the cause is. But we do know many times there are multiple causes. But to say that someone is just born that way, there's no scientific evidence that demonstrates that. Neurologists have studied this, others have studied this. There is no known one specific cause, but there are factors that influence this. We also want to point out, as we talk about this, we're going to get into comorbidities in just a moment, but DSD, that's a disorder of sex development. That is completely distinct. I know some people have confused that, and some people have asked me how that applies in here. That is not a part of the spill. That is an indication when someone has an extra chromosome. Instead of XX or XY, they might be XXY or something along those sorts. And then there are other types that have to do with virilization. People with intersex condition or DSDs are not affected by this spill. What we do know is that most people who experience gender dysphoria have comorbidities. Even up to 4 comorbidities. In other words, there's other things that are going on in their life. What are some of those other things? They include anxiety, depression, suicidal ideations. Autism is very high on the scale for people with gender dysphoria, schizophrenia, low self-esteem, bullying, and more. There are also some cases and some concerns about FDIA, which is fictitious disorder in another. And that's more commonly known or recognized as Munchausen syndrome by proxy. The name has changed. What we find is there are some cases, and there are reportedly some cases, and I've documented them, they're in your footnotes, where this is imposed on a child by their mother. In fact, there's one mother who has given a TED Talk. Her name is Amber Bingle. And in her TED Talk, she has a trans child, she says, who's about 5 or 6, at least at the time of the video. And she says, my daughter told me she was a boy from the womb. And so it's not a surprise when a mother might say that ultimately that child might identify that way. And you have to suspect that the mother's influence may have had something to do with that. Some other things that take place, and probably one of the most heartbreaking contributing factors is sexual abuse. There are many people that I have talked to personally who have experienced gender dysphoria, and it began because someone abused them. And that sexual abuse becomes something that needs to be dealt with, needs to be explored. I think it breaks every one of our hearts. We're not saying this is the case for everyone, but we're saying that this is the case. But when the only care or the primary care that you give to someone is to affirm the dysphoria, to affirm, say, yes, you are, and you don't explore that, you're not doing a service to the child. You're not helping that child, because that child is not able sometimes to even express the trauma that they have experienced. And what do? We just complicate it by covering over it and giving an escape out of that trauma. And many times they think, well, if I was a girl, maybe this wouldn't have happened to me. Or if I was a boy, this would not have happened to me. And we can talk to you about Walt Heyer. Walt Heyer is one of the oldest probably living people. He was one of the early pioneers to go through this. And his experience began because his grandmother started dressing him in a purple chiffon dress when she was babysitting him. And parents didn't know this initially. And after doing that, his uncle molested him. And that molestation caused other psychiatric disorders, but he thought he was transgendered. And so he went and he ultimately transitioned. He lived as a woman named Laura for 8 years. And he realized this was not alleviating his anxiety or his depression. He actually went to school at, I think, UCLA, and studied psychology and psychiatry and so forth. And he realized, I don't have gender dysphoria, I'm schizophrenic. And it's a real story. And he ultimately detransitioned, and he has a webpage that is entitled sexchangeregret.com, where many people, hundreds and hundreds of people, reach out to him and tell him, I wish somebody would have done more research. I wish they would have explored more. I wish they would have really found out what was causing my gender dysphoria instead of just instantly affirming me. And that there's story after story after story about that. But gender affirmation therapy is a type of therapy that is supported by intimidation, fear, manipulation, and isolation rather than education, information, and patience. What happens? A parent brings their child in for counseling and says, I'm really concerned. My child says that they want to be the opposite sex, that they're saying they are the opposite sex, and we're not just really sure about this. What happens, and this story is repeated over and over and over again, is the therapist will look at the parents and say, well, do you want a living son or a dead daughter? That's highly manipulative language. And parents love their kids, but they may be resistant, but they're like, well, what parent doesn't want to save their child's life? And so they're sort of bullied into this gender-affirming therapy. And when we're talking about gender-affirming therapy, we're not talking about just cross-dressing. We're talking about administering hormone blockers and cross-sex hormones to these children. And we can actually read here, the pediatrician said, this is a father giving testimony, if I didn't affirm my daughter's identity, and if I didn't get her the help that she needed, and she killed herself, I was going to feel awful guilty. He said that right there in front of my daughter. That is not professional counseling. That is manipulation, my friends. And so we move on. So only in recent history has gender, and I will skip that part, you can read about that. The most advised method by professionals is watchful waiting. Watchful waiting says, let's just take our time. We don't affirm the child, but we don't disaffirm the child. We don't try to lay guilt on the child. We don't try to change the child's feeling, but let's just, son, daughter, whatever, let's just take our time with this. Let's explore this. Let's not rush things. And that is recommended by such professionals, and everyone tells us to listen to the professionals, but they only want to listen to the professionals that they want to listen to. Dr. Kenneth Zucker. Dr. Kenneth Zucker is the foremost authority on gender dysphoria probably in the world. Dr. Zucker was the chairman of this division of the DSM-4 and the DSM-5, which is the Diagnostic and Statistical Manual. And he chaired the division that wrote about gender dysphoria. It used to be called gender identity disorder. They changed the name in order to take away the stigmatism of it being a disorder. And he advocates for watchful waiting. Dr. Stephen Levine was the chair of the 5th edition of the World Professional Association of Transgender Health, commonly known as WPATH. He chaired the 5th edition of their standards of care. And so certainly is open to this, open to transition and so forth. But he says, not for children. He advises watchful waiting. Dr. James Cantor is a neurologist specializing in the field of sexology. He is also a progressive. He is also a member of the LGBT community. He has written a paper that is entitled The Transsexual Bill of Rights. And he has a list of all the ways that you should show respect to transgendered individuals, including using proper pronouns and so on and so forth. But he advocates for watchful waiting. In fact, he has authored a blistering rebuke to the American Academy of Pediatrics recommendations for gender-affirming care for pediatrics. We're talking about a professional, someone who knows this, someone who is sympathetic with the trans community. Dr. Deborah So is also a neurologist specializing in the field of sexology. She's a fierce advocate for the LGBT community, and she takes the same position. Dr. Lisa Littman is I guess she would probably describe herself as a flaming liberal. She would never vote for anybody on this side of the aisle. She'd only vote for this side of the aisle. And she has done some research on this, and she advocates for watchful waiting as well. In fact, she discovered the phenomenon that is commonly known now as ROGD, which is rapid onset gender dysphoria, which is a social contagion that takes place mostly amongst teenage girls. And it comes after exposure to a lot of social media and so forth. You can go on YouTube all day long and you can find people who are giving these videos about their transition timeline and how wonderful it was and how wonderful it made them feel. And some people, some young girls watch that, get into that, and some young guys, and they think that is the answer to all of their problems, and it's not. Stella O'Malley and Sasha Ayad are gender specialists who also produce a podcast by the name of Gender, A Wider Lens, and they are gender therapists, and they also, one of them identified as transgender as a child, and they both advocate for watchful waiting. Watchful waiting is non-judgmental. It does not pass judgment, but it gives a time to a child to grow up and figure these things out. What's important to know as we look at this on watchful waiting is that 85 to 95%, and this is a statistic that's all over the place, you can find it, I think we footnoted it, 85 to 95% of children with dysphoria will desist after puberty. Puberty is the natural answer to gender dysphoria for most children, not for all, but for most. They will desist. But when you give that child puberty blockers, which they say is a pause, it's not a pause, because 95 to 100% of children who go on puberty blockers will not desist because they do not go through puberty, and they go on to cross-sex hormones, which are dangerous for them, and ultimately to surgery, which is irreversible. And I think I'm getting ahead of myself into the risk factors. But notice this. Here's what the leading therapists who do not advocate for watchful waiting, even they will say this. They say, gradually throughout adolescence, teens learn greater self-control. However, before that occurs, especially in early and middle adolescence, they tend to engage in risky behaviors as they are more focused on immediate gratification. As their brains develop the ability to think through the potential consequences of their actions, teens frequently act in ways that can jeopardize their social, physical, sexual, and emotional safety. And as they mature, they are more able to synchronize their behaviors with the increased recognition of potential negative impacts of impulsive decisions, as well as align their actions with emerging awareness of their long-term goals. And that came, it's the only scientific thing in the book, but this came from the Transgender Teen, a handbook for parents and professionals supporting transgender and non-binary teens. This is a go-to book, and they tell you that about a child's mind. And I thank you for your patience. I'm very close to being done, Chair. Thank you for your indulgence. But we want to look at some risk factors. Dr. Quentin L. Van Meter of the American College of Pediatrics warns that the grave side effects of transgendering include, but are not limited to, sterility, sexual dysfunction, blood clots, strokes, cardiac disease, osteoporosis, malignancy, and persistently elevated rates of suicide. Children and teens do not have the cognitive capacity to fully comprehend these risks. The manufacturers of Lupron Depot, which is the go-to drug for puberty blockers, they list the causes on their website, the uses of Lupron, or for men with prostate cancer, for women with endometriosis, and also with fibroids, and for central precocious puberty. The use of this for gender affirmation is off-label, is not recommended by the FDA. And so it's an off-label use. We read elsewhere, according to the American College of Pediatrics, in an article entitled Affirming Sex Change in Kids Violates the First Do No Harm. Dr. Zenga writes, and you can see his credentials up here, puberty is normal, natural occurrence. Puberty-blocking drugs create an abnormal condition that arrests a child's brain development as well as their physical sex characteristics. When combined with or followed by cross-sex hormones, they often result in permanent sterility, including permanent sterility. Cross-sex hormones in and of themselves are associated with debilitating health risks, including heart attacks, stroke, diabetes, cancers, and more. In addition, rates of suicide are nearly 20 times greater among adults who've used cross-sex hormones and have undergone sex reassignment surgery, even in Sweden, which is among the most transgender-affirming nations in the country. And so let's look at suicide by the numbers.
And Representative Click, I do very much appreciate your attention to detail. We typically do about a 5-minute limit, so we're at about 10 minutes. So if you could, get to the conclusion. Very good, I
appreciate that.
I know that members are very interested in asking questions, and I do want to allow
And I want
to
entertain that, and if you would like to move, let me just close with it. I'll skip a couple pages here, and you can read it. Thank you for your patience, Chairman.
Certainly, and I will just advise members, it is all on your iPads, and so I encourage you all to read through the detailed analysis that he's provided for us. Thank you.
It is hard to cram several months of reading and several hours of study and all of this into 10 minutes and make an effective statement, and I knew that was my challenge from the beginning. My first testimony was 25 pages, so I've worked on it. But thank you for your indulgence. Really, what this amounts to is informed consent. A child does not have the ability to consent. They do not have the ability to look forward, to look ahead. If you will pay attention, if you just Google detransitioners, you'll find on YouTube tons and tons and tons of people who've gone through this process and then tried to undo it. The average age, according to Dr. Lisa Littman, that takes place is the age of 24, which ironically is the same age that the prefrontal cortex of the brain becomes fully developed. Young people do not have the ability. I have some cases in here that are described for you from law and so forth. But what we're really trying to say here, and I will wrap up with this, and I will ask you to read this testimony because it contains a lot of facts, and it contains a lot of references to it. But there are just simply some things that kids cannot do and not allowed to do in Ohio and in many places around the world. Children cannot purchase alcohol or cigarettes or participate in gaming-related activities. Obviously, we all know that they cannot consent to sex under the age of 13 and may not consent to sex with an adult over the age of 13. Some other things I found that are interesting is that they cannot vote, hold office, marry, or buy or possess firearms. They cannot even play bingo, and they cannot donate blood under the age of 16. and because of informed consent. And so we need to make sure that before we start doing all these things, and please pay attention to the health factors, the health risks, we should not be able to sterilize children through the use of chemicals that leads to irreversible damage in these children because they cannot provide informed consent. When they are of the age of 18, they are free to do as they please, and they are free to pursue whatever life course and life path that they think best suits them. But children are not capable of making those decisions. And so I would urge you to support House Bill 454. And thank you for your patience in that process, and I am happy to entertain your questions.
Thank you, Representative Click. And again, we appreciate your attention to detail and your thorough research of this issue. So thank you for bringing that to us today. Are there any questions for the sponsor? Representative Liston?
Sorry, Rep. Humphreys, I preemptively raised my hand. I'm sure, I hope we all have opportunity to ask questions. I have a number, but I'll start with one that's relatively simple. You mentioned that you were asked to carry this bill, and you said our position multiple times. Can you share who asked you to carry this bill and who's the R you're referencing?
I was asked to carry this bill by parents, first of all, and also by CCV, the Center for Christian Virtue.
Follow up?
I have a secondary question, or
Sure,
okay.
Go for it.
A couple, actually. I think there's a fair bit of maybe confusion around some terms, and I just wanted to maybe talk about the concept of gender affirming care. What do you view that to be, and does it match what's currently happening at, for example, the programs at Children's Hospital and how they approach children with gender dysphoria and transgender children? I'm concerned that you're using gender affirming care in a very narrow context as compared to what actually happens. And are you able to clarify that?
Through the chair. I got that written down here because I always forget to say that. Through the chair to Representative Liston, thank you for the question. And I respect you greatly, and you and I have had many discussions on many topics, and I appreciate your expertise. When we're talking about gender, actually what gender means, and I skipped over that part in an attempt to get down the time, Chair, but the word gender has come to mean something that it's never meant before. Today, gender means an inward feeling about who I am. Gender originally was used to describe, gender was a word that was used linguistically, to talk about, especially like in Latin and Greek and so forth, to describe words as being masculine or feminine or neuter and so forth like that. That's what it meant. It has always been historically associated with your sex up until recently, when people began describing gender as an inward feeling about your sex. In other words, the idea that you can be a male on the outside, but be a female on the inside. And that is an ideology, that is a philosophy, that's a belief. For some, it's even a religion. The Native Americans used the term two-spirited for that, but it's not science. And so when we talk about when they say gender affirming care, what they mean is, as if a young man identifies as a young female, gender affirming care in their minds means we're affirming him as a female when he's not a female, or vice versa. Well, my perspective, and I think the perspective of many other professionals, is that you're not affirming the gender, you're actually affirming the dysphoria. And so I think we may disagree. I know what people mean by it, but we may disagree on that definition.
So I guess my follow-up would be, would you agree that care for children who are vulnerable and experiencing gender dysphoria, maybe transgender, is something that's highly individualized and requires the support of counselors, the involvement of parents, teachers, physicians, as well as the child, and that's a complicated space?
So I think through the chair, I think I was trying to say that, although I may not have said it as articulately as you did. But that individualized care is not what's happening, because what we see is happening is if you don't do anything besides affirming the gender, then you're not treating that child correctly. And I think when you treat that child individually, you look for anxiety, you look for depression, you look for anorexia, you look for autism, and you look for all of these comorbidities that are known to be present, and you don't instantly on day one say, yes, you are, but you take your time and you work through this with this child and try to resolve the comorbidities. This book here says, don't take care of the comorbidities first, take care of the gender dysphoria first. And this is a leading book. These are leading authors on this subject. And they say take care of the dysphoria first, then everything else goes away. And I don't think that's what other professionals recommend. They recommend looking at the comorbidities and perhaps the dysphoria dissipates.
All right, one follow-up comment, then I'll let people go and then hopefully be able to circle back around to another topic. So I guess your contention then is that children are not getting the support to look at other
Yes, ma'am.
comorbid diagnosis. Have you spoken with, for example, the Thrive Center at Nationwide Children's to talk about how they approach kids and what actually happens in Ohio rather than the book?
Okay, so I have, through the chair, I'm getting good at that part now. Through the chair to the representative, I have spoken with a number of people. I have spoken with the Ohio Children's Hospital Association. They were supposed to set up a meeting for me to tour one of the gender clinics in Ohio. That has not happened. I'm waiting on that to happen, and
Okay.
I will be happy to do that.
Yeah, I would invite you to look at it because that, is standard of care to provide that sort of holistic support for kids. And I will let that go and let others to come
And
back.
if I can just do one follow-up before we move on to the next question. And I would encourage you, because I know you, like I said, I have a lot of respect for you because you do your research. And part of your research, I would ask you to read some of the literature and perhaps watch some of the videos of the detransitioners who talk about how they were not given a full set of care, full standards care, full range of care, but that they were just rushed into it. Some of them can get puberty blockers and cross-sex hormones in a half-hour visit. That is happening. Planned Parenthood is actually, you check off 4 boxes and you can get hormonal treatment, not necessarily in Ohio, but it will come to Ohio if we do not take care of it. And just with quote-unquote informed consent, you can get your hormones. It is not, the standards of care are not what they should be in my estimation.
Representative Humphrey, and I do appreciate you raising your hand high. Recognize you for a question.
Thank you, Chairwoman. To the representative, I have a question because it's kind of going to align with Representative Liston's question. So when I was reading the articles and looking at the bill analysis, I think I want to ask you: are you aware that most times, like through the Thrive program at Nationwide Children's, it seems as if they already have to wait until they're 18, most times. And then there's no pressure. It has to be consent between the parent and the doctor. And so I guess this is doubling down on something that's already being done. Especially, there's only a handful of services that are provided anyway, but the Thrive program at the Nationwide Children's Hospital, more than likely than not, they have to wait until they're 18. So much so that at Kaleidoscope Youth Center, they have a group center where they talk about their frustrations and being angry about not being able to transition. And I guess that just proves my point to the point of they have to wait till they're 18 anyway. So what's the point of doubling down?
Through the chair to Representative Humphrey, first of all, again, welcome to committee, and thank you for your thoughtful question and for your research. I have a couple answers to that. The number one answer would be as if they're not transitioning, then this bill should not be a problem for them. But the follow-up on that is that when you say transition, there are multiple parts of transition. And social transition actually begins before chemical transition. And we're not even addressing that in this bill. We're not, if you want to have your child, dress and change their hairstyle and things differently, that's not addressed in this bill. However, what does happen, and it is happening now in Ohio, is the hormone blockers. And so you do not have to wait till you're 18 for the hormone blockers or for the opposite sex hormones. You can get those just before puberty and about the regular time of normal puberty. You can access those. And some states are starting, and others are starting to, there's a trend moving in that direction. If you do a little extra research, you'll discover that maybe 10 years ago, there were probably 6 gender clinics in all of the nation. Today, there are 6 in Ohio, and there are 300 in the nation. And so this is a trend that is moving and getting more aggressive in transitioning children. And I think that it's just proper and appropriate for us to put up some roadblocks. We're not telling people, again, what they can do as adults, but there are so many people who regret this later on. We want to make sure, and I think it's good for the whole community, the entire LGBT community, that only the people that transition is right for transition. And I don't think that, well, the evidence clearly tells us that's not happening. Otherwise, there would not be so many detransitioners. And so we want to say, if this is right for you, do your thing. It's okay. That's not my business or anyone else's business. But let's make sure that they're able to provide informed consent before they do that.
Follow up?
Thank you, Chairwoman. So this will be my last question, and it is literally just a question for you. Would you say that there is a major difference between hormone blockers and a surgery or procedure? Would you say that there is a difference?
That's through the chair to the representative. It's on the same train. It's like saying, is there a difference between the engine and the caboose? It's the same train. And so a child well, you're asking my opinion. And I respect you if you disagree with me. But I think the evidence demonstrates that once you start on puberty blockers, you will proceed to cross-sex hormones, and then you will proceed to top surgery or bottom surgery. And there's a young lady by the name of Kira Bell. There's links. Please watch that. It's so sad. Kira Bell is 23 years old, a biracial young girl in Great Britain. And when she was a young girl, she was a tomboy, and she was attracted to females. And her mom said, you think you're a boy? And she said, well, maybe I am. And so she started on that hormone blocker regimen. She started on the opposite sex hormones, and she transitioned as much as she could she had the top surgery, she had the double mastectomy, and then she regrets it. She sued Tavistock, which is the hospital that performed that surgery. But when you see, there are videos, there's links to videos. I would beg you to watch that, because Kira has a voice deeper than mine. She has a better 5 o'clock shadow than I do. And she looks very masculine, even though she's trying now to go back to being a woman. She has a girlfriend. She just wants to live her life. But even now, we talked, one of the other topics used to be like the bathroom bill a few years ago. She tries, as a biological female, to go into the girls' restrooms, and people give her a double take because she looks like a man. And this is because she was advanced in this process when it wasn't right for her. And that's the kind of people that I want to protect. Somebody who is 18, 19, 20, however old, and they want to do that, if they're happy, that's it's okay. But I want to protect kids who are not able to give informed consent and who will later regret this. And today, she doesn't even know if she's able to have kids or not because of this treatment. She won the lawsuit.
Representative Carruthers.
Thank you, Madam Chair. Representative Click, always a pleasure to see you. And as Chairwoman Manchester said, I appreciate all your thorough research. I do have a couple of quick questions. Have you spoken to any hospital associations, any doctors in Ohio?
Oh, yes. Through the chair, to the representative, absolutely. In fact, it was a doctor who was one of the ones who asked me to do this. A doctor who has this situation in his family and is dealing with this. I have spoken with other physicians. Some physicians, to be quite honest with you, I talked to them about this, and they 100% agree. And I say, would you like to come testify? And they're like, you understand that.
But not children's hospitals, not hospital associations.
And perhaps you weren't in here yet at that time, but I have spoken to the Ohio Children's Hospital Association. They've been to my office. They're supposed to do a follow-up and take me to the hospitals to see those. I told them I'd be eager to do that. That was supposed to happen in January. It has not happened. I'm still waiting, and I will be happy to go into those. I'm not afraid of information. You know, I want all the information possible. I'm not afraid of anyone or anything because it's not about me versus anyone else. It's about coming to the right solution.
Follow up? Okay. Representative Ginter.
Thank you, Chairman. Thank you for your testimony, Representative Click. We certainly appreciate it. Just for clarification, because this is a very difficult, challenging subject, and you've certainly taken on a heavy lift. We thank you for bringing forth this bill. But just so that we can clarify as we move forward, because this committee is probably going to be hearing a lot of information, but I want to back up for a moment and go to the motivation for this bill. Okay. You are a pastor. You wear another hat. Is that correct?
Yes, sir, I do, through the chair.
And so I want to check with you, are your religious beliefs the driving factor and motivation for this bill?
No, sir. Through the chair, no, sir. If my religious beliefs were the motivation, I'd be baptizing everyone in here before we're done today and a few other things. I'm just trying to bring a little levity to that. No, sir. And there are people who, that's one of my experiences since I've been here or since I've been engaged, is there's a few people who, rather than give a good response, they just want to attribute this, well, that's his religion. You know, I mean, you've been a pastor much longer than I have. I don't know if there's a verse that says thou shalt not transition. I don't think there is, because I don't think it was happening in the Bible days. And I am well aware of the difference in roles between the church and the state. Just because someone is a Christian, and I'm glad to be a Christian. Jesus Christ forgave me for all my sins, saved my soul, not because I deserve it, but by his grace. I'm not ashamed of that whatsoever. But I didn't come here to legislate my religion. That's not my role. That's not my responsibility. I believe in freedom of religion, but not freedom from religion. And even saying that, this bill does not have religious motivations. I just happen to be a Christian. I happen to be a pastor.
Follow up.
Follow up. Thank you, Chairman. So the intent of this bill then is in no way to make gender transition procedures illegal. It is simply focusing upon the age and informed consent.
Through the chair to Representative Ginter, you're absolutely 100% correct. We are not trying to, and that's one of the things that we had in our discussions we had early on, is adults should be free to do as they please. Our focus is informed consent, protecting minors, adolescents, keeping them safe, hence the title, saving adolescents, not saving adults, saving adolescents from experimentation.
Mm-hmm. Thank you. Thank you, Chair.
Ranking Member Denson.
Thank you. Thank you for your testimony. A lot of information to take in, and me onboarding, it's a lot of research to do. But I do want to ask a couple questions because the bill gets very specific about certain things. It gets very specific on how licensing bodies can punish, insurance companies can punish doctors, and how counselors communicate with their clients. Can you talk about your qualifications on overruling all of this expertise?
Thank you. Through the chair. I'm proud of myself. I keep saying that today.
Doing well.
Through the chair, to the ranking member. Thank you, first of all, for doing all of your research. And as you know, as with any bill that comes through this legislature, and I'm not sure how long you've been here, but you've been here longer than I have, I think. Bills like this are put together with collaboration with experts who provide that information and provide those resources. And that's how this bill was organized.
Thank you.
Follow up.
Thank you, Chairwoman, and thank you very much. I got to say, I was a little nervous for testimony today. I thought you did a great job of talking about an uncomfortable topic. I've sat in rooms many times and talking about this topic, and sadly to say, I feel like I couldn't educate myself or ask questions by fear of just being called out names or something because of me asking the question the wrong way. So I really greatly appreciate you bringing this. I do think it's an important topic, and I thought you did a great job. Are we seeing in the state of Ohio, whether it's child custody cases or child abuse cases, because of chemicals, not because of gender affirmation, pre-chemicals, but chemicals, gender affirmation, whether a parent is strictly holding off of a child and the child is accusing them of abuse because of that, or in child custody cases, the chemical aspect playing into how those decisions are playing out. Are we seeing that in the state of Ohio right now?
Through the chair to Representative Edwards, to an extent, yeah, we're seeing it across the country, and there are some documented cases that are in here. One of those documented cases actually involves a custodial dispute where a mother, and this ties back to the FDIA type of a situation, was pressuring her son to identify as a female, and this was the finding of the court, and not just in my opinion, it was a finding of the court, and there was a custody dispute between, and the father ended up with custody because the mother was pressing that. There was also a case that took place a couple of years ago in Cincinnati where parents actually lost custody of their son because to the grandmother because the son wanted to have the chemicals, the puberty blockers, and the cross-sex hormones, and the judge gave the custody to the grandmother rather than to the parents.
Follow up? Representative Troy.
Thank you, Madam Chair. Thank you, Representative Click. You've indicated that you're carrying this bill at the request of a doctor and a lot of parents.
Yes, sir.
I have heard from a lot of parents in my district who are opposed to this measure.
Yes,
so, I mean, I guess I think as Representative Edwards said, this is a very sensitive, it's a very heart-wrenching situation and all that. And so, you know, I kind of have a problem. I pause and ponder sometimes when the General Assembly decides that we're going to take one side of this issue or the other, you know, whether that's, you know, in areas like abortion, whether that's in areas like this. And you indicated that, I mean, I do see in the bill that it will criminalize activity by anyone who engages in this practice. So it definitely, we're taking sides, and we're also criminalizing something that I don't think we have, you know, really all of the information on at this point. Your comments on that?
Through the chair to Representative Troy, it's always a joy to serve with you, and I appreciate that. I appreciate your kindness all the way through the halls of the House here. And I understand that you're getting some emails. I'm getting emails both ways on this as well, and Facebook comments and Twitter, and I'm sure that's all going on right now during the testimony. But there are certain things, so sometimes it is, I'm like you, I believe in less regulation, but there are some times when the life and the well-being of a child is at stake. And what we're talking about here is children who will be forever sterile, will not be able to have children, children who are going to have double mastectomies, penectomies, penile inversions, things like that, that will affect them for the rest of their lives as children. And they can't go and recoup that. They cannot go get that back. And in fact, one of the interesting things, how some of these trans-identified people get stuck is when insurance companies do cover it, it's a one-way trip. They will cover your transition, but the moment you say, you know what, that was wrong for me, I want to go back, they say, oh, that's cosmetic. And that certainly is inappropriate. So I think there are certain times, and as I already documented here, the suicide rate is 20 times higher for those who transition. So because we care about kids and we want to save lives, I think it is appropriate for us to intervene.
Follow up?
Yeah, thank you, Madam Chair. Yeah, and you cited, you know, podcasts, you cited, you know, internet citations and things like that. You know, we can go on the internet, basically verify, affirm our position, regardless of what it is. Are there any, you know, behavioral health associations, medical associations that have basically indicated support of this particular measure?
100, through the chair, almost missed it. Through the chair to the representative, absolutely, the American College of Pediatricians supports this bill.
One final question. Thank you, Madam Chair. And so in the bill, it says it prohibits healthcare professionals from providing gender transition procedures to minors and from referring minors to a medical doctor for those procedures. I mean, basically, medical doctors have taken an oath to do no harm. Why would we prohibit at least a referral to these medical doctors to then be able to make that decision? I don't think they would make that decision, take that decision lightly, and would understand the risks and everything involved. I mean, I guess the question is, you know, we're prohibiting a lot of activity here that maybe will end up with the same result that you desire, is that they're not going to recommend this particular procedure to take place.
Through the chair to the representative, I understand your concerns. I think we're covering all of our bases, is the idea in doing that. They can refer, I mean, so referrals also include referring someone from Ohio to Kentucky or to Indiana or to Michigan or to Ohio. And we are trying to prevent this, you know, the American College of Pediatrics actually calls this child abuse. And we are trying to prevent that type of abuse of children that is going to jeopardize their lives by every means possible here in the state of Ohio.
Are there any additional questions for the sponsor, Representative Liston?
Thank you, Chairwoman. I have many, but I have to pause and make sure that we correct some misinformation, right? American College of Pediatricians is a socially conservative advocacy group of 1 to 200 pediatricians, as opposed to the American Association of Pediatrics, the AAP, which is the professional organization of tens of thousands of pediatricians for whom gender-affirming care is the standard of care, highly individualized supportive care, including psychiatric services, and ultimately transitions care as needed for transgender individuals with appropriate assessment, as well as the fact that puberty blockers do not lead to permanent lifelong sterilization. And I feel like we have to start with at least what the mainstream medical associations standards are. And whether you disagree with them or feel like they're gray or not, this bill comes down on a specific side against mainstream medical association opinion. And thus the burden of proof that they are wrong does fall to those who support this bill. And so I really want to make sure that that is sort of understood in the idea that we all agree that this is an individualized, you know, care of these children is very individualized. And so I'm super concerned about saying it's the state that has to come in, choose a specific side, criminalize what is considered to be mainstream care based on small groups of outlier statements. And I'm just really worried about that. And I know that you believe it's individualized care, and I want to make sure that that's something that people hear. And I don't know that that's it's a question. But I do have a question. If you,
Well, may I respond to that?
Yeah, go ahead. Sure.
Because if we go too far down the road, I'm going to forget what you just said.
I know.
I'm getting old.
It was a lot.
Through the chair to Representative Liston, again, I have a huge amount of respect for you. However, I'm going to counter some of the things that you just said. Calling the American College of Pediatricians conservative is no different than calling the APA liberal.
One is an advocacy group and one is a professional organization.
Let's stick to answering the question, please, Representative Click.
I'm sorry, ma'am. I thought that was an answer to that.
No, he was talking to me.
Okay. Are we following up then?
So on that side, so I'm just saying they are an organization made up of professionals. They're doctors. They're not activists. And do you recognize the DSM-4 and DSM-5? Are they authoritative? Through the chair.
The DSM-5 is a diagnostic manual of psychiatric diseases, and DSM-5 is the most recent version. It is how we definitionally look at disorders. So yes.
So you recognize that as credible through the chair. And Dr. Kenneth Zucker is the one who chaired this section, and he advocates for the same things we're talking about in this bill.
For criminalizing?
For the treatment. I think for criminalizing.
For watchful waiting as a component.
Address questions through the chair, please. Thank you.
Sorry, I'm trying.
Oh, for either. Through the chair, please. Did you have a follow-up question, Representative Liston?
I have a separate question. It's a totally different topic, but within the bill, I'm really concerned about the component that says teachers and counselors can't talk about specific things, that they're not allowed, this law dictates what teachers and counselors can say to their children that they're working with in crisis. And that is, that component of this bill I'm really concerned about. I don't know why it's in here that, that they're not allowed to say, or they're not allowed to say specific things. They have to alert individuals if a student comes and says that they're concerned about gender dysphoria. You've already alluded to the fact that some of these kids may be in unsafe circumstances, and we're taking that judgment out of that counselor's hands in terms of how to best proceed through this law. And I don't know what your thoughts are.
Through the chair to the representative, just one aside to the last one, we will have medical professionals who will come in and who will be better able to discuss some of your prior questions, much better than I am. And I look forward to that. And again, you and I have had conversations before, and I think you and I are very like-minded in that we care about people. Sometimes we just come at it from a different way, or come to a different means of achieving that. And the discussion, and please, thank you for the questions. I do appreciate the questions, because I know they come from your heart and they come from a good place. And so that's not an issue with me. But when you're talking about the school counselors, I have talked to people. I have firsthand knowledge of at least 2 schools in Ohio where a child goes to school as their birth gender. The school facilitates them socially transitioning during school hours, and then before school, and using their preferred names, their preferred pronouns, and so forth, and then changes back before they go home, and their parents are none the wiser. And so with this bill, what that portion of the bill that you're addressing says is schools can't take over for the parents. Parents have the primary responsibility for their children. And those counselors are hiding that from the parents. And in fact, the teacher is forbidden. The teacher in a parent-teacher conference, when talking to that child's parents, is not allowed to use pronouns, must only use the child's given name, and is forbidden from telling the parents what their child is going through. Parents are responsible for the children, not the state of Ohio. And when you conceal that, and we're not telling them how they can counsel, but we're telling them you cannot keep this information from parents. Now, you can invite the parents in, and you can say, hey, listen, we have something to discuss. And that counselor can provide whatever advice that they think is appropriate to the parents and to the child, and facilitate a social transition. We're not saying they can't do the social transition in school. We're saying you just can't do it behind the parents' backs.
Follow up?
My concern is in those circumstances where now a teacher has to tell a child who's in an abusive situation that they must disclose their gender concerns. And that bill actually says that the teacher's not allowed to say, or the counselor's not allowed to say otherwise, that they have to say, you must disclose, or you need to disclose this to your parents.
They're not, through the chair, they're not allowed to they're not allowed to encourage the children to keep it from their parents, is what they're not allowed to say, oh, Susie, don't tell your parents. Johnny, don't tell you. They're not allowed to say that. They're not allowed to encourage that. And I think what happens is we are presuming, and we know that there's some children who come from some difficult circumstances, and no one denies that. If the children are coming from difficult circumstances, that might be one of the comorbidities that is leading them to this, and they're only facilitating it rather than dealing with it. But we cannot presume that every parent is a bad parent. And when schools do that, they are automatically presuming that they know better than the parents. And this is why, I mean, just look over in Virginia at all the people that were in such an uproar over at the schools. They thought the schools thought they knew better than the parents. No school knows better than me for my children. No school knows better than you for your children. And we cannot let schools come in between parents and their children. That is a grievous error in our society when we allow that to happen.
Are there any additional questions for the sponsor? Seeing none, thank you very much for your time, Representative Click, and thank you for addressing through the chair. I appreciate that.